I'm Dr. Nair. I head the Department of Cardiology at PRS Hospital, Trivandrum, Kerala. This meeting, I'll be talking about a trial called EMPULSE trial. Now, EMPULSE trial is basically an old one which came in 2021. So you might ask why we are talking about EMPULSE trial now. We know that SGLT inhibitors are used in heart failure, and they are very good. They form one of those pillars of heart failure treatment. They improve survival, they reduce heart failure hospitalizations, they improve symptoms, they prevent sudden cardiac death. But what we learned from EMPULSE is that we can start these life-saving therapies early. Now, I know what you're trying to tell me, that yeah, we do that every time. We had been taught that heart failure therapies need to be started in hospital. So what we learn out of EMPULSE new sub-studies are, one, that the benefit of empagliflozin, the SGLT which was used in EMPULSE, kicks in pretty early. The diuretic effect kicks in about 1.5 hours time. And if we look into the clinical benefit, patient starts feeling better by day 15. So it is imperative that we start the therapy early. Now, how does it translate onto Indian scenario? So understand that for example, in US, 1 day of patient staying in hospital extra costs $5,000 plus. And if you look into Europe, it is about near $4,800. Right. But in India, we had a study which looked into all, right from West Bengal down to Kerala, all the states, average hospital stay costs. And you know what? It comes to about less than $110. So staying 1 extra day in an Indian hospital doesn't matter. Why we are talking about that is because what you do is, if your patient is not on guideline-directed medical therapy for drugs, you can easily ask the patient to stay back in the hospital for 2 more days and try putting him on the GDMT. And that would ensure that your patient on follow-up would be doing well. That's point number 1. The second point, the new learning from EMPULSE is that empagliflozin is an excellent diuretic. Yeah, we are trying to say it's a diuretic. And that diuretic, when we shift our focus from furosemide onto a loop diuretic, onto SGLT inhibitor, we get tremendous benefit. Why? Because long-term SGLT inhibitors have shown that there is improvement in survival. They are kind of safe. They are long-term effective, unlike a loop diuretic like furosemide. So even EMPULSE trial, which is 4 years old, has huge relevance on our learning and clinical practice today in India.